What I'd like to talk to you about now is what do we do when we have a body that is decomposing because no one has seen the individual for weeks to months, sometimes even years, and we have to identify the individual. So that we have, as an example, a body like this, in which there was very little tissue left on the body. This is the skull, this is the upper jaw, this is the lower jaw, and we have to estimate age, race, and sex by the first thing we do by looking at a skull. And all of you remember that in a baby there is a soft spot on the head, the fontanelles. And those fontanelles close off over a period of time. So here we have the top of the skull, and you can see there are no more soft spots. As a result of that, we know this is a mature adult individual. How old? Well, this individual here looks to be in his late 40s. How do I know that? Because I see changes in the structures that tell me he's certainly over 25, because not only are there soft spots in the top of the skull as there is in the baby, but you can see looking inside the skull that the same sutures, and we call those open and closed sutures, are also closed. So we're over the age of 25, 30. He looks a little older than that. Is it a man or is it a woman? Well, if you touch your eyebrow, the male eyebrow is much stronger than is the female eyebrow. The mastoid process, which is that little bump behind your ear, is much more prominent in a man than in a woman. And the facial structures are much stronger in a male than in a female. And of course, there are all sorts of variations. So looking at this, I estimated this to be a male in his late 40s. The third question we have to know, is he white? Is he black? Is he Asian? Is he Native American, Indian? And today that becomes very complicated because we have interracial mixing. But this is a man with almost round eyes, slightly rectangular. So this is probably someone who is mainly Caucasian or white, but does have some Negroid or African American in him. We have specialists who do this. These are known as forensic anthropologists. I have several as my consultants. And so we make use of these individuals when it is necessary to differentiate human from non-human. This is, again, an older skull. Again, you can see very rectangular, so it's probably much more African American. Rounder is much more Caucasian or Caucasoid. That is why the Native Americans in the old days called the white man round eye. Here again you can see there are sutures. They are closed, but you can still see them very prominently. This would be the soft spot in the front of the head, and this in the back of the head. And this individual was probably somewhere in their late 20s, early 30s. In addition to that, as we have from this individual has all his teeth. And what we can also do is have a forensic odontologist, that is a dentist with specialized training in the forensic sciences, tell us about the age of this individual by looking at the teeth. And if we have a second x-ray from a prior time available, we can then identify such an individual by comparing these teeth with the teeth from the dentist taking care of the patient. Finally, we have another way of identifying our friends. And that is, as you all know, we have sinuses in our head. The frontal sinuses on top of the eyebrows, the ethmoid sinuses inside of our nose, the maxillary sinuses on our upper jaw. No two people walking this earth, to the best of my knowledge, have the same pattern of frontal sinuses. Therefore, we can take an x-ray of this gentleman And again, if we have an x-ray from when he was alive, we can compare those two and positively identify the individual. It is necessary to identify the individual because we need to issue a death certificate, and we want to be 110% sure that the individual we are certifying is indeed the individual who is dead. It is bad form to issue a death certificate and the living person comes in to tell you, I'm here. And I don't say that with any jest, but I am well aware of a number of places where this has occurred.